The hospital has a deep-seated and genuine feeling about the individual patient. They really care, and they're kind. And I think it's pervasive. You see it with doctors, but of course with nurses and all of the staff.
I think I've known the Hamiltons for well over a decade now, and met Beverly first through her involvement here at Community Hospital. She was our board chair in 2006 and 7. During her tenure here at Community Hospital, she also was on the board of the California Endowment, an organization whose mission is to improve the health across the state. So she was constantly pushing us to do things better in the arena of community health, and in particular in the arena of diabetes.
I had the opportunity to spend time with a young woman who'd gone blind in her 20s from diabetes, and I learned about people who lost feet or hands or limbs to diabetes. And then I learned that CHOMP had a very good diabetes program. So I talked to them about putting the two organizations together and was able to introduce the California Endowment to CHOMP, and they subsequently gave them grants in 2006 and 2008 to initiate an outreach program into the underserved community.
Beverly came to us with a proposal for diabetes screening for people without the financial means, who have no insurance. She was full of ideas, and she identified RotaCare Clinic.
For diabetes,
RotaCare is sponsored by all 7 Rotary clubs on the peninsula, so it is a community-based free clinic. Okay, we have all of those back. Okay. Not only are doctors and nurses all volunteers, but all of the clerical, everybody's a volunteer.
I think for any nonprofit organization, the volunteers are key.
Okay.
They're great leverage, better leverage almost than money.
Okay, so you can put that box.
And I always consider that they represent a contribution to the health of the whole community that is just so invaluable.
And let's set this here.
72% of our diabetics, 72% of our care, our patients are diabetics, and it's growing rapidly.
97.7.
And because of Beverly, we were able to provide them with the medical care. We do all their levels. We get them tested fully through CHOMP. And then we give them all of their free medicines. We give them their free test strips, their machine to test themselves. If they're a type 1 and they have to take insulin, we pay for the insulin. We pay for everything. Okay, so I'll hand these to the patient.
People that were going to the emergency room time after time were now being seen at RotaCare. That's saving the hospital probably hundreds of thousands of dollars and improving the quality of life for patients.
I actually started making contributions to my university when I was 22 or 23. I felt that I should pay back the scholarship fund for what they had done for me. So that eventually then, over the years, developed into support of education, and then now here in the community, healthcare for the underserved. I think what CHOMP really has done for the community is to give us a sense of confidence that if anything at all happens to us, that we have the best right here within 15 minutes or half an hour of where we live.